Welcome to our virtual tour of the UC Davis Health Department of Physical Medicine and Rehabilitation, where our mission is to lead in collaborative, coordinated care and discovery in order to improve health, function, and quality of life of our patients. The nationally renowned 625-bed UC Davis Medical Center is the only Level 1 trauma center for both adult and pediatric emergencies in the inland Northern California. In addition to providing the highest level of trauma care for our region, UC Davis is committed to promoting diversity and educating providers and healthcare leaders of the future. We are located in Sacramento, the capital of California, a vibrant city with ready access to wonderful weather and all that Northern California has to offer. Hello, my name is Lauren Davidson, and I am the Residency Program Director for the Department of Physical Medicine and Rehabilitation at UC Davis Health. On behalf of our UC Davis faculty, residents, and staff, I am honored to invite you on a virtual tour of the UC Davis Physical Medicine and Rehabilitation Residency Program. Our historic resident complement consists of 11 residents, comprised of 3 physicians in each postgraduate year 2 through 4. In addition, 2 categorical interns receive their PGY training at UC Davis, while 1 advanced physician does their internship external to UC Davis and joins us at the beginning of their PGY 2 year. We are in the process of incrementally expanding our residency program to 4 residents per year, so please follow our website for current information. Our department's clinical and academic faculty pictured here are led by Department Chair Dr. Craig McDonald and share a common passion for excellent clinical care and teaching while promoting diversity and inclusion. We are also excited to announce the newest additions to our PM&R family to include Dr. Allison Campisi, who has just completed her Brain Injury Medicine Fellowship, and Dr. Alyssa Speciali and Dr. Kevin Mullins, who have recently completed Sports Medicine Fellowships and will be joining our rapidly growing Sports Medicine team. Resident training in acute inpatient rehabilitation medicine for adults is led by Dr. John Dorsett and Dr. Danny Neudorf. As part of a tertiary care Level 1 trauma center, UC Davis provides excellent clinical exposure to both common and uncommon rehab diagnoses. Inpatient pediatric rehab is provided by the Peds Rehab team with inpatient units at both UC Davis and Shriners Hospital. In addition, we are excited to announce plans for a new freestanding joint venture rehabilitation hospital located on the UC Davis Health campus. The new facility is scheduled to open in 2023 and will increase capacity from 23 beds to 52. At UC Davis, our almost 2-to-1 faculty to resident ratio provides ample clinical variety and opportunity for one-on-one teaching between faculty and residents. Our neuromuscular medicine training is provided via multidisciplinary clinics for adults and children with neuromuscular disorders and have been designated as Duchenne muscular dystrophy and ALS centers of excellence. Residents will have exposure to diagnostic workups, including molecular genetic studies, EMG, and muscle biopsies. Of note, UC Davis has the only PM&R-based ACGMA accredited neuromuscular medicine fellowship in the United States. Electrodiagnostic training starts in the PGY 2 year and is continuous throughout the residency outpatient rotations, representing approximately 6 months of full-time experience with both pediatric and adult patients between UC Davis, VA Mather, and Shriners Hospitals for Children, Northern California. The structured longitudinal electrodiagnostic instruction prepares graduates for the certification examination by the American Board of Electrodiagnostic Medicine and Independent Practice. Our adult outpatient spinal cord injury clinic is led by Dr. Holly Zhao, a subspecialty certified physician in spinal cord medicine with dual appointments at both UC Davis and the VA Medical Center. Comprehensive and multimodal spasticity management is provided by Dr. Lisa Williams and Dr. John Dorsett for the adult population and Dr. Shauna Arsenal for the pediatric population at UC Davis. Residents will have ample exposure to baclofen pump refills, programming and troubleshooting, vocal botulinum toxin injections, and oral antispasmodic medication management. Adult Amputee Clinic is led by Dr. Chris Shin, who provides care for patients with limb deficiency at both UC Davis and the Mather VA Medical Center. In addition to traditional Western medicine training, residents also have exposure to acupuncture, acupressure, and complementary medicine under the direction of Dr. Holly Zhao. Our C Street UC Davis Clinic is the primary home to both our comprehensive multidisciplinary sports and spine clinics. Sports medicine at UC Davis is our largest and fastest growing division within the Department of PM&R and home to a well-regarded and highly competitive sports medicine fellowship. At present, there are 5 sports medicine subspecialty certified physicians within the department, led by Division Chief Dr. Brandy Waite. This number will expand to 7 with the addition of Drs. Speciale and Dr. Kevin Mullins. Trainees at UC Davis can expect excellent exposure to non-operative sports and musculoskeletal management, which includes training in diagnostic ultrasound. Our UC Davis PM&R sports faculty, Dr. Brandy Waite and Dr. Brian Davis, currently provide event coverage for the Sacramento Republic FC professional soccer team, California International Marathon, UC Davis Division I Collegiate Athletics with Dr. Jeremiah Ray, and Team USA Olympic Gymnastics with Dr. Marcy Faustin. Under the direction of Dr. Julie Ingerson, trainees also receive in-depth exposure to sports medicine for the pediatric population through clinics at Shriners Hospitals. As part of a comprehensive spine center consisting of PM&R faculty Dr. Carol Vandenacker and Dr. Chris Shin, our residents evaluate patients with spine-related dysfunction and triage these patients to non-operative therapy paradigms, interventional procedures, or operative pathways. Pediatric rehab training at UC Davis is strengthened through our clinical partnership with Shriners Hospitals for Children, Northern California, our primary training site located on the UC Davis Health Campus. At present, UC Davis has 4 faculty with subspecialty certification in pediatric rehabilitation medicine and 2 additional PM&R faculty certified in sports medicine and neuromuscular medicine, respectively. Focused subspecialty pediatric rehab medicine clinics and experiences at Shriners include spinal cord injury, spina bifida, cerebral palsy, pediatric AMG, amputee, brachial plexus birth injury, neuromuscular disease clinic, comprehensive spasticity management, and gait and motion analysis. Additionally, UC Davis and Shriners is currently home to the only ACGME accredited pediatric rehabilitation medicine fellowship in California. Our affiliated training sites include the Mather VA Hospital, where residents receive additional training in EMG, spine and musculoskeletal disorders, interventional pain management, palliative care, prosthetics, orthotics, and limb deficiency. Under the direction of UC Davis alumnus Dr. Michelle Palvogi, residents are trained in occupational medicine in the setting of a large managed care organization through Kaiser Health, South Sacramento. Through our community physician partners at Dignity Health, Dr. Albert Huang, and UCD alumnus Dr. Jeremy Wren, residents are able to experience a community-based inpatient rehabilitation practice. In addition to traditional weekly didactics and hands-on instruction in physical exam and musculoskeletal ultrasound, at UC Davis we understand that learning is a hands-on sport, as explained by Dr. Brandy Waite.
You have to have some what we call true didactic learning, where you kind of sit in a classroom and learn, but we know that's not the best way to get all of the whole picture. Stay low, and as you're doing your straddle jog, make your hands like pancakes and push down in the water.
A lot of these therapies are new to us. We write the prescriptions all day long, but actually seeing the different techniques and experiencing them is all new to us.
Now try and push underwater.
And so for us to get our hands on some of the flotation devices and some of the balancing techniques is really important.
So this gives you a little taste of what your patients can experience working in the water.
To gain greater insight into adaptive sports and participation for persons with disabilities, UC Davis residents are able to trial a variety of adaptive equipment due to the generosity of our community partners at Access Leisure. Residents and fellows at UC Davis are actively involved in mentored research and are supported to present posters and podium presentations at national conferences. Resident wellness is a priority at UC Davis, and our residents know how to have fun, whether it's floating down the river or Zumba with Dr. Waite. Our residents are a fun and cohesive group that know how to have a good time. Thank you for joining us on our virtual tour of the UC Davis Health Physical Medicine and Rehabilitation Residency Training Program. Hopefully this tour adequately demonstrates the diversity of our residents and faculty and broad clinical exposure across the full breadth of PM&R in a fun, close-knit, and collaborative environment. We hope to have you join us here at UC Davis. Thank you.